Are you worried about your prostate health? Today, we're going to talk about something that affects millions of men, prostate health. You might not know this, but the prostate, a small gland located near the bladder, can actually grow throughout a man's life. This growth can sometimes lead to a condition called benign prostatic hyperplasia, or BPH. Now, before we dive in, I have to give my usual disclaimer. This video is for informational purposes only and shouldn't be taken as medical advice. If you have any concerns about your health, please talk to your doctor. With that said, let's get into the 8 signs of an enlarged prostate you absolutely shouldn't ignore. And stick around because we'll also cover the best foods to eat for prostate health. The first sign we will discuss is frequent urination. We've all been there, right? That feeling of needing to pee all the time. You see, as the prostate grows, it can press on the urethra, the tube that carries urine from the bladder. This pressure can make you feel like you need to pee more often, even if your bladder isn't actually full. And here's an interesting fact. Increased levels of estrogen relative to testosterone can actually contribute to prostate enlargement. Now, this doesn't mean you should avoid estrogen altogether. It's all about balance. But it's definitely something to keep in mind as we discuss the other signs. Let's move on to the second sign. Difficulty starting urination. Have you ever noticed that it takes a bit of effort to get your urine stream going? This might seem like a minor inconvenience, but it could be a warning sign of prostate enlargement. You see, when the prostate enlarges, it can put pressure on the urethra, making it harder for urine to flow freely. This pressure can lead to hesitancy, where you have to strain or wait before the urine starts flowing. In some cases, you might even feel like you need to push or bear down to initiate urination. Not exactly a pleasant experience, right? All right, guys, let's talk about the third sign, weak or interrupted urine flow. Imagine your urethra like a garden hose. Now picture your hand squeezing this hose. What happens? The flow gets constricted, right? That's exactly what happens with your urine flow when your prostate is enlarged. You might notice that it's not as forceful as it used to be, or it might feel like you have to strain to get the urine out. And sometimes the flow can even be interrupted midstream, which can be pretty frustrating and concerning. The next sign is an urgency to urinate. Ever feel like you have to rush to the bathroom with barely a moment's notice? It's a feeling that can catch you off guard, making you drop everything and sprint to the nearest restroom. This sudden and intense need to urinate can be both embarrassing and inconvenient, especially if it happens frequently. Imagine your bladder is like a balloon and the prostate is a hand squeezing it. When the prostate enlarges, it starts to press against the bladder, much like a hand squeezing a balloon. This pressure can make the bladder feel fuller than it actually is, leading to that urgent need to urinate. And the more the prostate enlarges, the more pressure it puts on the bladder, even when it's not very full. This issue makes you feel like you must go right now, even if you just went a little while ago. It's a frustrating experience that makes it difficult to focus on work, enjoy social activities, or even get a good night's sleep. Imagine being in a crucial meeting or enjoying a night out with friends, only to be interrupted by the sudden and urgent need to find a restroom. This can lead to anxiety and stress, as you're constantly worried about when the next urgent need will strike. Research suggests that inflammation in the prostate tissue can irritate the bladder, leading to a feeling of urgency. Inflammation is the body's natural response to injury or infection. Think about it like this. When you have a cut on your finger, it gets red, swollen, and painful. That's inflammation at work. Your body is sending extra blood and immune cells to the area to help it heal. But this also causes the tissue to become irritated and sensitive. Similarly, when the prostate is inflamed, it can irritate the bladder, making it feel like it's full and needs to be emptied immediately, even if it's not. This irritation can cause the bladder to contract more frequently, leading to that urgent need to urinate. This growing urgency is not always recognized as a medical concern initially, but it's important to pay attention to your body's signals. So, if you find yourself making frequent, urgent trips to the bathroom, don't ignore it. Reach out to a healthcare professional and get the help you need to address this common issue. Moving on, have you ever finished using the bathroom but felt like you didn't empty your bladder? Like there's still something left behind? You see, when the prostate enlarges, it can actually obstruct the flow of urine, making it difficult to fully empty the bladder. Imagine trying to pour all the water out of a bottle, but there's a cork stuck in the opening. You can squeeze and squeeze, but some water will always remain trapped inside. That's similar to what happens with an enlarged prostate. The blockage prevents the bladder from completely emptying, leaving you with that uncomfortable feeling of urinary retention. All right, let's talk about another sign of a potential prostate issue that you might not want to discuss at the dinner table: dribbling after urination. We've all been there, right? You think you're done, give it a little shake, and then, boom, surprise dribble. While occasional dribbling can be totally normal, if it's happening frequently, it could be a sign of an enlarged prostate. Think of it like squeezing a ketchup bottle. If you don't get it all out, you're likely to end up with a little extra on your plate later. Not ideal with ketchup, and definitely not ideal when we're talking about your prostate. This one might be surprising, but it could be a potential sign of an enlarged prostate, urinary tract infection, or UTI. Now, you might be wondering, what does my prostate have to do with my bladder infections? It's a great question, and one that many people have. The prostate and bladder are closely linked in the male urinary system, and changes in one can significantly affect the other. An enlarged prostate can cause a partial or complete blockage of the urethra, making it difficult for urine to pass through. And that's where the trouble starts. When your bladder doesn't empty fully, it leaves behind residual urine. And when urine hangs out in your bladder for too long, creating a breeding ground for bacteria, hence the UTI. This condition can cause a range of symptoms, including a burning sensation when you urinate, frequent urges to urinate, and cloudy or strong-smelling urine. So, if you're experiencing frequent UTIs, especially if you're also noticing other symptoms like difficulty urinating or a weak stream, it's crucial to talk to your doctor. All right, we're continuing our discussion on the signs of an enlarged prostate, and this time we're tackling a symptom that can really disrupt your sleep nocturia. This condition is more common than you might think and can affect anyone, but it is particularly prevalent in older men. Nocturia is the medical term for waking up multiple times during the night to urinate. Look, we all wake up occasionally to use the bathroom, but if you make frequent trips throughout the night, it could be a sign of an underlying issue. Imagine waking up every couple of hours, interrupting your sleep cycle, and leaving you feeling groggy and exhausted the next day. It's not fun. The lack of quality sleep can affect your daily activities, making it hard to concentrate and perform at your best. If you're experiencing this symptom, it's important to talk to your doctor. They can help determine the cause and recommend the best course of treatment for you. Your doctor might suggest reducing fluid intake before bedtime, avoiding caffeine and alcohol, or taking medications that can help manage the symptoms. In some cases, surgical options might be considered to relieve the pressure on the bladder and improve urinary flow. Making simple lifestyle changes like drinking more fluids during the day and less in the evening can also make a big difference. It's all about finding the right balance and working with your healthcare provider to manage the symptoms effectively. And before we go, let's quickly touch on some dietary choices that can support better prostate health. Certain foods are associated with promoting a healthy prostate, and incorporating them into your diet can make a significant difference. First up, pumpkin seed oil. Rich in zinc, it's known for its anti-inflammatory properties. Next, cranberry supplements, which can help reduce urinary tract infections and support overall urinary health. Tomatoes are another great option, thanks to their high lycopene content, which has been linked to a lower risk of prostate cancer. Green tea is also beneficial, as it contains antioxidants that can support prostate health. Don't forget cruciferous vegetables like broccoli and cauliflower. They contain compounds that may help protect against cancer. Fatty fish, such as salmon, are rich in omega-3 fatty acids, which can help reduce inflammation. Berries packed with antioxidants can help protect your cells from damage. Finally, legumes, including beans and lentils, are good sources of protein and fiber, which can support overall health. Incorporating these foods into your daily routine can be a delicious way to promote a healthy prostate. That wraps up our look at the 8 signs of an enlarged prostate. We've covered a lot of ground, from frequent urination to difficulty starting and maintaining a stream, to the link between BPH and UTIs, and the sleep-disrupting effects of nocturia. Remember, these symptoms can be caused by a variety of factors, and it's crucial to consult with your doctor for an accurate diagnosis and personalized treatment plan. Early detection and management are key to maintaining your prostate health and overall well-being. If you found this information helpful, give us a thumbs up and hit that subscribe button so you don't miss out on future health tips and advice. And don't forget to share this video with your friends and family. You never know who might benefit from learning more about prostate health. We'd love to hear from you. Share your thoughts, questions, and experiences in the comments below. Thanks for watching, and take care of yourselves.